Well, wonderful. Hello, everybody. Welcome to a lunch and learn today. This is new for my VIP clients, and I know Jennifer has some of her VIP clients that they've been invited also. So I'm so excited that everyone could join us. And for those of you who are joining us via recording, welcome. We are glad you made it. And I'm just going to jump right into it and introduce our guest speaker today, Dr. Jennifer Haessler. And Jennifer and I, we've known each other for several years. She is, in addition to being a doctor of naturopathy, and Jennifer, you correct me if I'm wrong, because sometimes I'm a squiggle. I might call things the wrong thing.
You're
But
good.
we ended up at a leadership conference together. I believe it was in February, and it was a lunchtime break. And it's kind of like you just sit wherever you want. And Jennifer and I ended up sitting and having lunch together. And I don't know that we've ever sat down together for a long period of time. We've said hello in passing, follow each other on social media, but it was great to have lunch with her, and we got to chatting. And I invited her to come speak to my VIP group. So it's taken us a couple months to get it all together because with schedules and everything, but I am very honored to welcome her. Jennifer lives in Canada. And Jennifer, I'm just going to have you go ahead and take over now and introduce yourself. And I want to see maybe if I could do the speaker. There we go. The star of the show. Your skin looks great, by the way.
Oh, thank you.
It's all that good eating and exercise. So
I hope
please,
so.
Jennifer, the time is yours, and we are honored to hear from you today.
Oh, thank you so much for having me here. So, Renee and I are both like OG faster way coaches, right? I have been, I think, since about the same time. I think I officially became a coach in September of 2018, and you were maybe a little bit before that.
April of 2018, so
Yeah.
same year.
I think it just took me a little longer to get through all of that. But I think we were like in a similar cohort. So I've been a naturopathic doctor for over 20 years now. I'm licensed to practice in Ontario, which is the province where I live. And yeah, when I knew Amanda Trass, obviously, I think all of us know she's the creator of the Faster Way. I'd worked with her in another life, helping to create my own online program. And then I had another baby, and I have 4 kids. And he was definitely not my easiest baby. And I was kind of like scrambling for how to sort of get a semblance of myself back. And so I decided I was going to try Amanda's program. So that was in March of 2018. And I liked it so much and felt it was such a good fit with what I encourage my naturopathic patients to do, that I wanted to become a coach when that opportunity presented itself. So I think we were like in the first batch of coaches that came out.
Ah,
So Renee asked me, we've kind of known who each other was for a long time, but yeah, in February, that was kind of our first opportunity to sit down and really have a conversation. So that was kind of special. And she asked if I could come and speak today about how nutrition and exercise plays into hormone balance. So that is a big focus of my practice. I mean, I don't just have female patients, but that's by far the largest demographic. Most of them are in either perimenopause or menopause. And I think knowing what we can do to balance our hormones is so important no matter what stage we're at, because we all still have them, right? Like they're doing different things if we're cycling versus not cycling. But having a good balance of hormones is still really important to our overall health, regardless of what stage we're in. And I know it's easy to kind of want to get like all fancy and, wonder like, well, what's the best supplement? Or, hormone replacement therapy is kind of coming back into trend again these days, and everybody's talking about that. And it does have a place. That's something that I can do as part of my scope of practice for my license is in Ontario, so I can prescribe hormones for people that live in Ontario, but I actually don't do it that often. And the reason being that if we put all the right supportive foundational things in place, it's often not necessary. And so my goal is always to try and help each individual be able to get to a state of balance without needing a lot of, with minimizing the outside support. And a huge part of creating that foundation is what we eat and how we live our lives, and that includes how we exercise too. And that's why I love the faster way so much, because it's one thing to say, you should eat healthy and you should exercise, but knowing exactly what that looks like and guiding someone through the process, that's where the faster way really excels. And then we have the added benefit of community and, being able to feel like we're not doing it alone, which is when I'm working one-on-one with my patients, we have our visit, we might see each other again in 6 weeks or however long it is, but I'm not there to like guide them through day to day like I can be as a faster way coach. So I really love that part. So that's what I'm going to talk about today, just how we can help to encourage hormone balance by how we exercise and how we move our bodies and how we live our lives on a daily basis. And not to say, sorry, go ahead, Renee.
No, I was just gonna say, and so from what I'm hearing, just even in your introduction, no matter if you're postpartum, whether you're perimenopausal, whether you're in your 30s, whether you're in your 50s and in menopause or postmenopausal, like these principles serve us well, right? And I think that a lot of times in the culture that we live in, a lot of times it's like, well, let me just do this one thing so I can get balance, right? But this to me sounds like, hey, we're creating an environment in our bodies, no matter how old we are, how young we are, so that our hormones can respond optimally for the age and stage of life that we're in. So I don't want anybody turning this training off thinking, oh, I'm, 70 years old, or, oh, I'm only 30 years old. Like, this information is valuable for every age and stage of life.
Absolutely. Yeah. And we were talking about, like, not to say that sometimes we don't need extra things. Like, I do talk about supplements but I can't effectively help somebody with even the best supplement in the right dose if they don't have this foundation there. Like, yes, it will do something, but it's like as soon as you stop taking it, you're right back where you started, right? So if I'm really helping people to improve their health, part of what I do needs to be incorporating a foundation that really supports good health. And our bodies are so smart, right? Like, it's really quite amazing how, our bodies tell us these things as a sign that something's out of balance. And so we want to listen to that and help reestablish that balance, not just try to always like put band-aids on things and pretend that, how do I make this go away? So if anybody has questions as I go along, I'm not Renee, you can keep an eye out, like, please type it into the chat or raise your hand. We will leave some time for questions at the end too, but I want this to be, as interactive as possible, and don't hesitate. Like, I know for me, if a question comes to mind, I'm going to think about it continuously so I don't forget, and I won't be paying good attention. So if something pops into your head, just type it into the chat or raise your hand, and then we'll carry on. So don't hesitate if you do have a question. And I should mention too, like, I very much am, I just turned 48. Well, I guess now it's already a couple months ago. Time goes by so fast, but I very much am in the midst of what I'm helping my patients with. And thankfully, so far, the transition has been pretty smooth. I try to practice what I preach. And so I personally know that what I talk about makes a difference, has made a huge difference in my life. And I definitely see it be able to help my patients and my faster way clients. Another point I wanted to make is that not everybody who's my faster way client is also my patient. Like, sometimes people come to me just for the faster way. And that has really been a huge eye opener for me in terms of how much can change even when I'm not looking at their blood work. And I'm not, like, if somebody wants to engage in that one-on-one deep detailed health history kind of thing, we can do that, but that's not suitable within like the constraints of my faster way coach relationship. So we're talking about the same things that you would talk about with Renee, and it's amazing to me how much gets better. So, even like one example comes to mind of someone who had really bad reflux and lots of inflammation and pain. And yes, there's some great natural anti-inflammatories and there's some great things that can help with reflux. But I said, to be honest, like I'd really love to start with the faster way. We can do both together, but like I just feel this is such an important piece. And so she decided to just focus on that. And like within, I don't even think it was 2 weeks, like she no longer had reflux, right? And I didn't do anything in terms of supplements. She wasn't waking up in pain every day. Like food is such powerful medicine. And I'm pretty sure each of us has a story we could share, and how learning about eating to fuel our body optimally made a huge difference in how we felt, even if we weren't coming from a really, quote unquote, unhealthy place to begin with.
And it's
So,
interesting because you mentioned reflux, right? And so in our society, I don't know how it is in Canada, but I know in the United States, all of these commercials are on. And so somebody who is suffering from, reflux or some type of issues like that, the first thing generally they're going to go for an over-the-counter medication, right? Or go to the doctor for a prescription, but without looking, well, what is the basis of how can I address what is causing that? And that's what I love about what you do, is you're looking at the root cause and how nutrition and food can help with that.
that's right. And, sometimes it is as simple as just cleaning up how we're eating.
Mhm.
Sometimes there are structural issues, right? And then I'm definitely not like anti-conventional medicine at all. But I think, if we take some antacid of some kind and like right away the next meal the symptom comes back, like obviously there's something underlying going on there that needs to be addressed. We don't want to just eat bottles and bottles of antacids and think like, oh, it's fine. We also don't want to leave like reflux untreated and have that lead to much more serious things, right? So a lot of times, like the patients I'm dealing with, it's a combination of, some of them are on medications, and we're looking to optimize health or reduce dosing by improving their overall health. So one big thing that happens to all of us as our hormones start to change into menopause and beyond is that because of those hormonal changes, we start to break down muscle at a much faster rate. And that's a big reason why a lot of women doing exactly what they've done all along start to gain weight. And there's a number of reasons, like decreased muscle mass makes us more insulin resistant. That's a whole other discussion, and I won't get, but like affects our blood sugar regulation. And insulin is a hormone that, like all of our hormones, has a domino-like effect on the other hormones in the body. So we want to eat in a way that doesn't make us insulin resistant, and the faster way approach very much does that. Another thing about decreased muscle, obviously we lose strength, right? And that's super important. It might not seem like a big deal when we're in our 40s, but as we get older, if we continue to lose muscle strength, that greatly affects our quality of life. And, so often I hear people say, oh, I hit 40 or whatever age they pick, and everything started to go downhill. I'm like, okay, things change for sure. We are not the same person as we were at 20, and we can't get away with the same things that maybe we could do at that point. But it absolutely is possible for all of us to still feel great and strong and energetic and confident. And, my sort of mantra is like, chase strong, don't chase skinny. Like we can have those physical goals as well, of course. But, I think many of us at this stage in our life start to realize like, the skinniest version of me wasn't necessarily the healthiest version of me. And right now I want to create the healthiest version of me so that I have a whole lot more years to live coming up. Were you going to say something, Renee?
Well, when you mentioned insulin resistance and how that happens, as that can be a problem as we age, could you just explain a little bit? Because I think that's something that is talked about a lot, but maybe people don't understand it and what the
Mhm.
importance of that and why we don't want that.
Yeah. So I actually just did, if you, I'm sure Renee can share this info after, but I put on my blog, I have a blog on my website, and this is actually the topic. I broke it up into 3 parts because there's so many things to say about insulin resistance. But basically, whenever we eat any carbohydrate, it gets broken down into simple sugars. So this is true for healthy carbs and for carbs that are not so healthy. But obviously something like a piece of cake has a lot more sugar slash carbohydrate in it than something like an apple. But they do both get broken down to simple sugars. When those sugars are in your blood, it sends a signal to your pancreas to pump out some insulin. So the more sugar that's there, the more insulin that's going to be required of your body. The job of the insulin is to bind to the insulin receptors that are on every single one of the cells in your body. And it's like a key that fits into the lock and opens the door. So once that door is opened, then the sugar can get out of the blood and into your cell where it can be used as a source of energy. So that's why carbs are such a, like, they are our most efficient fuel source. I know for myself personally, that was one change I really noticed when I started counting macros was I had so much extra energy than I did before. And I hadn't even really intentionally been restricting them. I just wasn't eating enough. So what happens with insulin resistance is that key doesn't really work properly in that lock anymore. So either it doesn't fit in at all, or it fits in, but it won't open the door. And so your body starts pumping out more and more insulin, trying to get some of it to bind. And as long as some of it is binding, then if you were to just check your blood sugar, it would still look fine. When your body gets to the point where that insulin is so resistant that it can't bind properly anymore, that's when the blood sugar level starts to go up. And that's what type 2 diabetes is. Now, in my patient base, like if all we do is check blood sugar, we really, unless someone is diabetic, won't see insulin resistance. So what I do in my practice is I also check their insulin level to see how hard is that person working to keep their blood sugar level where it is. And that's where I see a lot of my menopausal patients falling. Like their blood sugar is still okay, but they're working really hard to keep it okay. And that's a big reason why things aren't working properly. Does that, like, I'm trying to not get too nitty gritty in
Yes.
details, but does that make sense?
Yes, and I will actually get that blog and I will include it with the recording because I think that's something that we do hear a lot about, but maybe have a lack of understanding. So that's great. Thank you.
Yeah. So like the one that was 2 weeks ago, I talked about like a description of what I just said, what is insulin resistance and what happens. And then last week I talked about, how can we mitigate, decrease the chances, or how can we deal with it if we do have insulin resistance in terms of diet and different treatment options. This week's is actually going to be about Ozempic and that class of medications and how they play into insulin resistance. Because they do have an effect on insulin resistance, but no matter what approach we take, we still need to be doing our strength training and eating our protein because we need our muscle, right? If all we deal with is the insulin resistance piece, but our muscle mass still continues to decrease, we're really not getting any healthier at all. And, we're still going to get weaker, even if we're getting skinnier, right? And yeah, we're also going to become more insulin resistant over time, which not only does that affect our weight, that also increases our risk for high blood pressure, high cholesterol, cardiovascular disease. So it's super important for our overall health to live our lives in a way that helps to keep our blood sugar regulation in a healthy spot.
Absolutely. Thank
Does
you.
anybody have any questions about that piece before I move along? And the other piece about protein too is that protein gets broken down into amino acids. Those amino acids, not only do they build muscle, they also are important for our neurotransmitters. So mental health is something that a lot of women notice a change in as their hormones are changing. We need to have those building blocks to be able to make serotonin and dopamine and, the brain chemicals that help us feel happy and fulfilled and in a good place in our life. So, I think it's a catch-22. Like a lot of people get really discouraged that they're gaining this abdominal weight. And so they cut back on what they're eating. They're often, like, I'm sure Renee would say the same, pretty much. And then many of you could say the same, pretty much everybody, when they come to Faster Way, you're not eating enough protein, like the vast majority. Would you agree, Renee?
Oh, 100%. And I think what I love about what you're discussing here is that so often clients come to us and they're just focused on that number on a scale, not realizing like, hey, it's not so much about changing that number, but it's about gaining the muscle. And this all, if somebody has some background noise, could you please mute out your thing, please? But what it does is it helps them to support their hormones, which works together for the entire function of our body, right? So I know that this can sometimes seem like, oh gosh, this is harder information, but I think it gets us past just focusing on a number on a scale, because we need to look at the bigger picture sometimes, that it all adds up, and fueling our body with enough nutrition, especially making protein a priority to build that muscle, affects our body 100% more than just a number on a scale. And so many women just chase a number on a scale, not realizing the impact on everything else in your body.
Right. And I feel the frustration of so many people. Like I think we all can relate to, we all have an area or areas that we, wish would be a bit different on ourselves. I think that's like a common trend, but to remember, like, it takes time, right? It takes time to build that muscle, especially if we're starting out where we haven't been doing a lot of strength training. We haven't been eating enough protein. We need to start building that muscle. And, we want, if, as long as you're seeing some non-scale victory changes, when we always talk about those, you have to trust the process that the scale victories will come to. And sometimes our idea of what the scale victory is supposed to look like, it's helpful for it to shift a little bit also, right? Like, I don't know if anyone's seen, I know I've seen them on Instagram and Facebook, like the picture where there's like 5 or 6 women who are all the same weight and look completely different. Or even one woman who it's the same person, same weight, totally different physical shape. Right. So yes, the scale is an objective marker, but I think we give it way too much credit, right? Because it's really just our relationship with gravity. It doesn't tell us how much body fat, we have, how much muscle we have, how much fluid we're holding on to, or how well hydrated we are. And so, we'd much rather, I think all of us agree, I want to be living my life with energy and no pain and sleeping well and seeing myself get stronger. And hopefully, yes, if there is, a need for some loss of body fat, that comes as well. And it will when you're doing all those other pieces. But like, you are so much more than just that number, right? So that we want to try and shift our mindset that needs to be our main piece of focus.
And Jennifer, the other thing that the scale doesn't measure is what our hormones look like, right? The balance of our hormones. And now, I don't know if you're going to lead into this, but are there types of things that would kind of make us think, wow, something might be off here? Like something, it's not just about, oh, I'm gaining weight, but are there symptoms or some telltale signs that might tell us that something is off with our hormones?
Yeah. So, I mean, a lot of them, I think those are the reasons why people come to see me, like hot flashes, night sweats, changes in mood. Like I'll see some women say, like, I just, don't feel like myself anymore. Like I'm so short with my family. I just don't know. Like I can't pinpoint something that's happening, but I just don't feel like myself. Trouble sleeping. I mean, some of these things are more complicated than, like there can be a number of reasons that play into it. But I think anything, like we all have this like inner feeling when, I just don't feel like I think I should be feeling.
Mhm.
And you can go to the doctor and get some blood work run. And, a lot of the women will say, like, Bill, they said everything's fine, but I just don't feel good. I think, listening to, like, keep looking for those answers, because trust that intuition, because nobody knows you better than you know you, right? So, but yeah, definitely, if women are still cycling, like if they're having premenstrual symptoms that are quite extended, that could be a sign something's off. And then menopausal symptoms after the fact, which, yeah, most people, they're aware if they're having those. If you're not having any symptoms at all, then that's a sign that you're in a pretty good spot and you're doing a good job, and you probably don't need to do a whole lot of extra stuff. So there's two main hormones that we're often talking about when it comes to like female reproductive hormones, estrogen and progesterone. We also have testosterone, but we have a lot less of it than men do, but that does play a role as well. Cortisol is a hormone. I mean, there's lots of hormones in our body. Now, when we're cycling still, estrogen is the dominant hormone in the first half up until ovulation, like from when your period starts until ovulation. And then the second half of your cycle, from ovulation until your period comes again, that's a progesterone dominant phase. And even when you're no longer having a period, you still need a balance of both of those hormones. And the menopausal symptoms happen when that's not the case. Now, like when we're cycling, our ovaries are producing these hormones each month. So when we go through menopause, the levels of the hormones do decrease because that stops happening. However, it's not like you go down to zero. Like we still can make hormones. Fat cells produce estrogen. And there's different forms of estrogen. So they produce a less active form of estrogen. I would say a lot of the patients I deal with, it's not actually, I mean, sometimes it is estrogen that's the issue, but more often the common thing is progesterone. So we don't want too much body fat pumping out all this estrogen, because then that really creates a differential between the estrogen and progesterone levels. The other big source of hormones is your adrenal glands. So I don't know, but that's little organs that sit on top of our kidneys, pump out cortisol, DHEA, adrenaline. And the problem when we get to menopause or close to it is that many of us are really burnt out. We've been moms and working and taking care of family members and all the things. And so they're very busy pumping out cortisol and adrenaline, and it's really hard for the adrenals to take on the extra job of now making estrogen and progesterone as the main producer in the body. So no matter whether I'm prescribing hormones or not for a patient, I'm always working to also support their adrenal glands through lifestyle. That's like sleep, why it's so important. If we're running on empty, without enough rest, that automatically means you're pumping out extra cortisol. And then, the type of obviously life we're living, like we can get away with burning the candle at both ends, but many of us notice we get to like our 40s and like we realize something's got to give, like we just can't continue to do that. So supporting, and then there are also like herbs and B vitamins, different things that can support the adrenals. But again, like you could take all the B vitamins in the world, but if you're not sleeping enough, it's going to be really hard to get your adrenal glands to a more balanced state, right? So we still need those foundational pieces of the faster way are still so important.
And Jennifer, are there specific foods? Now, I know that we focus on whole foods in the faster way, but are there specific foods? I don't know if this is correct because we didn't plan these questions, but that are like hormone friendly foods, like
Yeah.
that are good to incorporate into
Yes.
our everyday whole foods based diet.
Yeah. So that's a perfect segue to what I was going to lead into next. So yes, exactly. So we're talking about estrogen and progesterone. So we want to be supporting a balance of both of those at all stages. So things that help with estrogen, vegetables that are part of the brassica family. So that's things like cabbage, cauliflower, Brussels sprouts. They all contain things called indole 3-carbinol, which is helpful for establishing estrogen balance. So there's 3 different types of estrogen that our body can make. One is more helpful. One is more harmful, like more related to hormone-related cancers, and one is sort of more neutral. So we want to be promoting the helpful one. And that's one of the things that indole 3-carbinol does. So all of the vegetables within the cruciferous family are really helpful for estrogen. The other thing that's very helpful is fiber. I mean, fiber is good for so much, right? Obviously, digestion and our microbiome health in our gut. But if we are not eliminating regularly, the bacteria in the gut will actually break down the elimination form of estrogen and make it so it can be reabsorbed and start recirculating again. And so obviously that leads to higher estrogen levels, and it's not the helpful form. So having more fiber helps to eliminate so that the bacteria is not able to do that. And so flax also contains lignans, which help with estrogen balance. And in addition, it's a source of fiber. So ground flax seeds are a great thing to add to help with estrogen balance.
Jennifer, can I just say too, what kind of made me a little light bulb moment here, when you were talking about, the fiber, and a lot of times our clients have a hard time hitting our fiber goal. It's 25, but I think even up to 35 grams of fiber per day is important. And so this shows you when you make the switch from processed foods, right? Processed foods are not very high in fiber, right? And so how just changing to the whole foods helps with our gut bacteria, with our hormone balance, because now we're going from these processed low fiber foods now to a fiber rich diet.
Exactly. And I mean, there's actually data too that shows, having a healthier microbiome, like better gut health, leads to a better metabolism, and that people will lose weight. Even they do some studies where they just try to, like, they take the microbiome from a healthier person and put it into somebody who's overweight, and just making that bacterial change actually helps them to start losing weight. And there's a huge gut brain connection too. So in terms of cravings and like there's a lot of levels there, but yeah, for sure, fiber is a very important piece of helping with our metabolic health and with our hormone health, and obviously our digestion.
So fiber and protein, I would say, are two, because we do talk about hitting that protein, but let's remember that fiber also. So when clients come to us who've been eating low carb, right? Because we have our fiber rich carbs, which are also very healthy for us. So that's why we're not like low carb, no carb all the time.
That's right. And I mean, this is a whole other discussion, but I'm
I
like,
know, I'm just
people be like, I'm sorry to tell you about my poop. I was like, no. I talk about poop all the time because it's so important. My kids are like, don't tell mom if you didn't go poop today because she's gonna make you do it. But like, just to give a visual, because I'm a very visual person, like ideally, like we should be having a bowel movement that's like as long as your arm every day. I mean,
Really?
obviously not one like, but like, and a lot of people even having a daily bowel movement are still constipated. And so fiber is and water obviously are very important pieces to like get that happening, because if you're constipated, that will be a big impediment to hormone balance because there's stuff sitting there and you're getting this reabsorption that's happening.
Yeah, that's a great point, because I know I have worked with clients who don't have bowel movements every day.
Oh, many. Yeah.
Yeah.
And even people who do, and it's like, like, yeah, and we don't know till we know, right? Like, no, not to be judgmental of anybody. Like, I mean, but you start when it starts to happen, you're like, oh my goodness, like that's a lot.
So what would be the first, so then what would be a good action step for that? If you are a person who doesn't have a bowel movement every day, or just a very small one, what would be 2 or 3 tips that you would say or would be helpful?
So one thing, look at your fiber for sure. I mean, a really easy thing ties in with the hormone balance too. Start adding 1 to 2 tablespoons of ground flax seeds to your overnight oats or your smoothie, or my protein yogurt mix would also work, or like anything really that you can mix it into. I mean, I also use chia seeds too, but when we're talking specifically, the flax has with the lignans, ground flax has more of a benefit there, but chia seeds are another easy way to up your fiber.
That's one of my
Make
favorites.
sure you're drinking enough water. Sometimes people will find like drinking a glass of warm water with some lemon in it. I don't even think the lemon is really a key piece. It's just more to make it more palatable.
Mhm.
Do that first thing in the morning when you wake up, before you have your coffee even. And that can help relax things to help stimulate a bowel movement. And then, I mean, you got to be careful with how much, but magnesium is for sure something that I find can be very helpful too.
Okay.
But you don't, if you take too much, like you will, your body will absorb what it can. And if you take more than that, it just draws water in. And then that will, you're not trying to create an enema and diarrhea, right? Like you just want to relax things enough that it's easier for things to pass through. But what we eat is for sure the biggest place to start, because that fiber and that water are hugely important.
Great.
And then when we're looking at what helps with the second half of the cycle, this is where sometimes I will modify the faster way a little bit if women are still cycling, or even if they're not. It's just helpful to be mindful about that. Some women will say, like right before their period, or just at certain times of the month, they find it's really hard. Their low carb days are much harder.
Mhm.
And so that can happen as progesterone is becoming more dominant. So if you observe that, then I say try to up your net carbs a little bit on your low carb days to like 75 to 100 grams, and see if that feels better. Or if you notice even just that you're consistently hungry on low carb days, I think just we are all different, right? And some people do need the extra carbs, and then you would decrease your fat a little bit if
Right.
that was the case. Yeah. So hormones can change how, like we generally want more carbs in the second half, right? We think of they're like, oh, what's wrong with me? I'm having all these cravings. Sometimes it's just that we need to up those net carbs just to support that progesterone in the second half. Healthy fats are important all the time for hormone balance, because it's a major building block for making hormones and for brain health. So, we're always wanting to make sure we're getting enough like avocado and coconut oil and nuts and seeds. So that is just something to be mindful about. I mean, I think most of my clients anyways, fat is not usually where they struggle getting enough, because it tastes good and it's pretty easy. It's
Well,
more
it's
the carbs and the
interesting
protein.
though, because I think that I think what this is a really interesting thing you just said. Our hormones need those healthy fats, yet society says don't eat fat. So clients sometimes they get confused with, well, I have high cholesterol, or I don't want to get high cholesterol, so I'm not going to eat. I'm eating low fat. I get a lot of DMs. I'm eating low fat and low carbs, or I'm getting 100 grams of protein. And these aren't my clients, these are just people that send me
Mhm.
information. So the fact that you just said that healthy fats also help with our hormones, I think this is
Mhm.
good, maybe a mindset shift that we also need to get a hold of, because a lot of people think fat is fat. I know I came from the generation of like the fat-free foods that were loaded with sugar, right? Oh, this is fat-free cookies. I can eat a whole box of fat-free cookies, filled with processed sugars, right? So, how is it too like sciencey to say like how does the healthy fat support our hormones, or is that too much?
Well, it's a major building block for making them. So we can't
Okay.
have enough hormones if we don't have that building block. I mean, when one type of fats, essential fatty acids, like I think most people have heard of omega-3s,
Mhm.
omega-6s, omega-9s. Many people get enough omega-9 from what we eat, and we can make 6 from 3, but we can't make 3. We have to eat it. And so and it makes up the outside membrane of every single cell in your body. So it's
Interesting.
important for your skin health. It's important for hormones. It's like every cell, it's important for everything.
Yeah, yeah. Are there some
So,
particular foods that are higher in omega-3s?
well, fish is a big one.
Okay.
I mean, it's the highest for sure. There's certain I mean, that's again where we can get really detailed, like flax oil contains the precursor to active omega-3
Uh-huh.
fats. Not everybody is very efficient at doing that conversion, and it's not easy to measure like who is a good converter and who isn't. So fish is like it's preformed, it's there, it's ready to use. So that is why like fish oil is such a popular supplement. And
Okay.
I mean, eating fish is definitely the preference, like it's
Mhm.
in the most natural form. Um, so yeah, it's much more concentrated than anything else that we can get, but it is present in smaller amounts in some foods.
Right.
And I think always like just listen to your body, right? Like we sometimes think we need to overcomplicate things. Like if you find that your low carb days are always so hard and your not energy is not as good and you're starving, then definitely talk to Renee, or if I'm your coach, talk to me. And that's where we would say like, well, try bumping it up a little bit and see how you feel better. Eat those healthy carbs, like the squash and the oats and quinoa and that kind of thing. Have a little bit more berries and see how you feel, because ultimately whatever you're doing needs to feel good, or we're never going to be sticking with it long term. And it's our body's way of saying like something's not right. We've
Mhm.
got to change it.
Right.
So we want to listen to that. Another thing related to hormones, like if you aren't sleeping well, if you're feeling like your energy isn't where it should be, then that would be a reason to do the less intense HIIT workouts,
Mhm.
either the modification, or if people are really burnt out, I'll even say, just add in some extra active recovery on those days and take a break from the HIIT for a little bit. And let's work on your sleep. And because if you're really exhausted and then you go and you do a super intense HIIT workout, you're like pushing, you're squeezing the last of the energy out of the sponge. We want to try and build that back up.
Mhm.
So going back to that hierarchy of priorities within the faster way, like the bottom is always our nutrition, right? That was always will give you the most benefit. Next, important, sleep. We need to get enough sleep. Strength training, HIIT at the tippy top is like classic cardio.
Mhm.
So if we're like, where should I focus? Life is crazy, or I'm so tired. What should I do? Like you'll never go wrong focusing on your food.
Mhm.
And then add the other things in as you're able to.
So question
Um,
related to sleep and nutrition. Now, I don't know if this is back in the day, I used to be one of the corporate coaches and in the corporate Facebook rounds. And one of the things that I heard several coaches and Amanda talk about was if you're having trouble sleeping, and maybe you can tie this in with nutrition because I don't know how this works. But I've heard Amanda say like to take a few slices of banana with some like almond butter and a little Himalayan sea salt, and that can help you sleep. Can Do you know anything about that, or why that particular with the almond butter or peanut butter?
well, I know, I mean, there's a number of reasons why people might not sleep. Like one can for sure be cortisol levels, right? Like if life is super stressful, or if you're like working on your computer right up until, or watching, I don't know, an intense show on your phone or whatever, that cortisol can impede sleep. So sometimes I'm looking at helping them reduce that, both with like lifestyle where we can make shifts. Sometimes things like magnesium or GABA, they might be helpful. The banana and the nut butter piece, sometimes it can be blood sugar related. So
Okay.
if we eat some protein, so you're not getting like a blood sugar dip or a blood sugar spike,
Mhm.
that can make it easier. Um, and sometimes like it can be a neurotransmitter, like people not getting enough protein.
Mhm.
Sometimes taking some extra protein just by itself close to bed can be helpful. So it's not so simple that like one thing will always work, but that is a really important piece that I work on with my patients, because we have to sleep, right? Like if we're not sleeping, it makes sense we're going to be running on empty. And then things won't work the way that they're supposed to.
Big
So
that combination might keep your blood sugar more stable because you've got the fats from the nut butter with some carbohydrates. So
Yeah.
it's creating so it doesn't, and maybe like the salt has some electrolytes or something. I don't know. But that was just something I've heard more than one time, and I didn't know if there was something to that from the
Yeah,
nutrition.
probably related to blood sugar balance. I mean, electrolytes are another thing that I find are really helpful for a lot of people too. Like, I know we're also afraid of sodium. We think it's going to be bad for blood pressure and,
Mhm.
but I think when we're getting it from real foods, not processed junky foods, I see many cases where that really helps people have more energy throughout the day.
Mhm.
So yeah, we always, we want to get super complicated, but I think like trusting the process of like meeting our macro goals really does have a big difference. Focusing on our strength training, maybe the HIIT, if you're able to, the HIIT is very helpful, but for sure strength training is key. And then being mindful of, like, I think the other thing, we can't take away all stress, right? All of us have stress, and some stress is a good thing. Like, without any stress, we wouldn't be motivated to do much with our lives, right? Like, we think of it in a negative way, but there's also deadlines and things can be a positive motivator too. Um, but what I really talk about is, also think about, like, are you doing things that are fun in your life, right? Like, we get so caught up on all the things we should do, or like maximizing, thinking of productivity in terms of income. And, yes, we need a certain amount of that to create a life that is in alignment with what we want. But I think also like prioritizing fun and what brings you joy, and, not just taking care of everybody else in our life, but taking care of ourselves too. And that's a big piece that's often, people will push that to the bottom of the pile because they put more importance on all these other things.
I think
So that's important too, to being happy and healthy, right? Is
well, fun. I think I see this with, like, I call this my type A clients because I am a squiggle and I'm like, it's fine. But if we're so wound up on doing everything perfect all the time, and we have to get our workouts in and we have to hit our macros exactly, I have to get my water and I have to fast 16 hours, like we're so regimented in everything, yet we're not having fun. And
Mhm.
that is a simple thing. Like, go have fun. Just so y'all know, I saw in Jennifer's Instagram story, she's doing karaoke and like a little bit of like a theater thing, right? And I was like, oh my gosh, I thought that was great, right? And so often we are, whether we're working full time, taking care of kids, taking care of aging parents, whatever stage of life you're in, sometimes we forget to have fun. And that can also affect our hormones. It could just be like, go out and do something fun. Stop attaching everything to, like, I have to do this so I can reach this number on a scale, or I cannot break my, and just like maybe you just need to have a little fun.
I think it's so true. And the story, that was my first time doing karaoke, the thing I posted in my stories. But I was in musical theater this year, and I auditioned with my daughter because I thought it would be something fun for the two of us to do together, this play that our local theater was doing. And then she decided she didn't want to do it.
And she
And they
left.
had offered me the lead role. And I was like, I didn't even know I could sing. Like, I was 47 years old. I didn't know I could sing. But it was a big eye opener to me. I actually found out I love singing, and like, I'm not so bad. And I think I was so caught up in so long, like my practice, my kids, and in the last like 5 years or so, I've been like, that they're fine. Like, I don't need to be at every single thing that they do. I also want to look back and be like, are we going to look back and be glad that we tracked our macros perfectly every single day for how many months, right? Or
Yeah,
are we going to look back and be like, damn, I took that vacation, or
right.
went and sang in the musical, right? Like,
Yeah, and and it's sometimes it's the simple things that we can do that we're missing the mark on. And to know that we put so much stress and so much like rigidity into everything when we have health goals. And sometimes maybe what our hormones are needing is just a little fun. So we can reduce that stress a little bit in our life, you know. Oh, I'm in perimenopause. Oh, I'm panicking, or I'm in menopause, I'm panicking. I've got a little extra body fat, right? Where sometimes maybe we just need to let our pedal off the gas a little bit. And it could be such a simple answer to what is going on. I love that.
Yeah, and remember, it's and like that does have its place too, right? We can't like we need some objective measures to help us figure out where we want to be relative to where we are. But if it starts to feel overwhelming, like it's okay to take a break, right? And focus on eating whole foods. Like you're
Mhm.
never going to be wrong doing that. Focus on moving your body. If it's like I live where there's winter, so this time of year, like it's so joyful to get outside. Get outside,
Right.
right?
Sometimes
Like,
we just need to get outside. You don't need that Starbucks in the afternoon. What you need is to get outside, drink some water and some fresh air, and just listen to those little birds chirping, right?
yeah.
You know,
Yeah, there's so like joy and laughter is true medicine too,
mhm.
right? And you think about how often kids run around laughing and giggling and like, a lot of us we don't do that so much anymore. So it's good to reflect on that and just think like, okay, I can't eliminate all stress. Like, we're a sandwich generation. We got parents to take care of and, maybe grandkids, whatever, but like what can I do to still bring some joy and happiness? Like, because
Yeah,
life never well, eventually it stops, right? But like, it's not like we can wait until everything is calm because that's
right.
not likely. Rarely does that happen.
Absolutely.
I see there's some people who posted some comments, but I can't see.
So, well, we had one. So Janetta is like, these are great reminders. She's reading a book right now. Um, and called The Artist's Way by Julia Cameron. She says, great for this, I guess, about doing fun things. But we did have a question from Lisa that said, I've had in menopause, I've had a lot of hip and joint pain, which is new for me over the past year. I know that's a very common feedback we hear from a lot of our women going through peri and menopause. She says she's started estrogen and weight training. She's experienced some relief, but she wonders if the pain is increasing my cortisol, which then works against me when trying to lose weight. Like, could that be, we know cortisol is a normal function, it
Mhm.
spikes naturally, but the pain that she's having, could that cause issues with prolonged, I guess,
Well, I
elevated?
guess it depends. Like, if it's really like intense
Mm-hmm.
pain, I don't think it's a good idea to be like pushing through that to do
Right.
a workout, right? You want to be looking at either alternative ways to move your body. Because yeah, there's like good pain, right? Like the pain after we've used muscles that haven't been used for a while. But then there's all, yeah, to push past something that's like really chronically uncomfortable probably isn't going to be super helpful unless it's like part of a physio training, where there's a plan to get through that. Um, I mean, part of the reason why inflammation can go up can be that insulin resistance. So like that's something to look into with your care provider.
Mhm.
A functional medicine doctor would be more likely to have that as part of their wheelhouse of looking at things.
Also,
I
gluten.
mean, it
There's
can
just like,
depend. Like, is it like a knee issue? Like, is there something structurally going on with the joint, or is it just generally like you wake up with pain in the morning and then it goes away once you get moving?
mhm.
That's more osteoarthritis, right? Where you're like feeling like you're all creaky. And a lot of times people will notice that improves a lot, like just with changing diet and
Well,
exercise.
gluten also with the joint issues. My husband, we both have joint issues, and I've been telling him, I'm like, you eat too much gluten. I'm telling you, if you just decrease. And so finally, he's listened to his wife. He's like, I've been cutting out my sandwiches, and all the. He goes, and my knee's feeling better. I was like, duh. Like this is that. Like again, a lot of times we're looking for just something where it's like, hey, let's get down to the nitty gritty. Let's just take out some of this inflammatory things in our body and see if that just doesn't take some inflammation down, right? And it
Yeah.
always goes back to, as you said, the pyramid. The foundation that we can all start on is nutrition. That is
Yeah. And
best.
then like next level, if you've tried like gluten and dairy are for sure the two big things that a lot of people have issues with, either one or both. I mean, there is a IgG blood test that you can do that checks how much immunoglobulin G you're making against 120 different food. Well, the test I typically do is 120. There's different panels. But that can be, helpful because sometimes it's not the person's eating unhealthy. It's just something that they're eating is not agreeing with them. And
Interesting.
then part of that would also be like, I want to identify any foods that are creating, like fueling the fires, so to speak, but also I'll work to improve gut health. Like fix any leaky gut, make sure there's enough good bacteria there, get rid of anything that shouldn't be there, like yeast or suboptimal bacteria. So, I mean, again, that's a whole big topic, but a lot of what people come to see me for will in one way or another go, part of what we'll address will be their gut health, because that does have, like, we have more immune system in our digestive tract than anywhere else in our body. So if things like, if it's not happy, that's what's creating inflammation. And if we get that more balanced, a lot of times that'll put out a lot of those other fires.
Yeah.
So that's where, like, yeah, still Faster Way is a great foundation. Sometimes we do need to dig a little bit further though and figure out why.
And we have a question from Janetta. She's like, what's the best way to get your adrenals in check? I know I need to work on getting rest. My cortisol levels have been higher, but turned around since the faster way.
Awesome. I mean, it does take time, first of
Mhm.
all. Like it's, not like it takes, if we've been in a cycle of like really having adrenal fatigue for a long time, it takes time to build it back up again, right? So it doesn't just like switch overnight. I mean, getting your 7 to 9 hours of sleep, whatever it is that you need, that differs a bit from person to person. What we talked about before, like doing things that bring you joy and happiness. Like if we're in a job that we hate or a relationship that's not bringing us joy, it literally like sucks the life out of us, right? We can't always change those things, but sometimes we can. So looking at what we can do to create more happiness around our life is helpful. And then there are, like, it's hard for me to say, take this supplement, because it's not like I'll just give one thing to everybody. Like I will listen. Some people are tired and wired. Some people are, tired and not wired. Some people, depending on what other health issues they have, I consider like an herb that would address a number of areas. Or the other thing, like I check blood work to look at like vitamin D and B12 and magnesium levels. And so if I see that there are deficiencies there, like we need a lot of magnesium to help our adrenals. So if that's low, that's going to be helpful. So it's
Mhm.
kind of tricky to answer that without knowing a full detailed case history, but there for sure are things like, doing what we can. It's like a car, right? If our oil's low or an area isn't working properly, it's really hard to get our car to drive efficiently. So we need all of these areas to be in balance so that our body doesn't have to work so hard just to survive and get through the day.
So related to this, and I know we're coming up on an hour, we need to wrap it up, but I see this a lot. Speaking of adrenals on social media, the adrenal cocktails that they'll have like some type of, LMNT with, certain things. Do you know anything about that? Can you address
Well,
that?
I think it goes back to what I said, like in replenishing levels that are low, like a
Okay.
lot of people are low in magnesium and
Uh-huh.
sodium, right? That's like the LMNT is
Right.
sodium, potassium, and magnesium. And
Electrolytes.
yeah, so electrolytes do really help a lot of people, but
Uh-huh.
me included. So I don't think, like, it's hard to say because it's not like we're just giving one thing, but
Right.
I think it's because so many people are universally depleted.
Uh-huh.
And if we're working, like stress burns through magnesium very quickly. And then the other piece is it's hard to get enough magnesium even when we are eating healthy, because it depends on what's in the soil, and the soil is not as rich, we know that, as it used to be. So even if we're eating healthy foods, we're just not getting the same amount, and then we're using it up super fast.
Right.
So
Right.
I think that's why so many people feel better taking more magnesium and sodium. I mean, there's like they work together, right? There's like this osmosis that goes on. So taking some extra like one thing being low usually doesn't mean just that is low, because
Right.
everything works together in this amazing balance.
Well, it was interesting when I was in Costa Rica several months ago. I was feeling so like tired and hot and just, because we were so active and things. And so a lot of the coaches I was with, they all had like the packets of like electrolytes. And so I was like, can I have some? And I'm telling you, it perked me right up. Like
Hmm.
not just plain water, but just throwing some of those electrolytes in there that has the other. And I know
Yeah.
Pastor Way is coming out with their own that I actually got to taste, and it is amazing. It's really, really good.
Oh, I'm excited
Um,
to try
yeah,
that.
so anyway, but I do see like the adrenal cocktails a lot on social media. So it's interesting, that might just be something to try. Also, I've seen with cream of tartar.
Well,
So
so cream of tartar has potassium.
okay, all right.
So like you can make your own. I mean, I just use the powder because,
Yeah.
mama don't have time for that. But you can take like 4 ounces of ideally freshly squeezed orange juice, not fortified, and put in like half a teaspoon of sea salt and a quarter teaspoon of cream of tartar. It's a wine byproduct and high in potassium.
There you go.
And so that's like that's another natural electrolyte mix.
Yeah.
But like, I mean, obviously there's too much of, it's possible to take too much of anything. But what I usually say is like try one of those, like Element's a great one, Relight is a good one. I'm sure the Faster Way one will be good when it comes out. But there's a lot of electrolyte mixes out there that are actually like they don't have nearly enough of anything. So both the Relight and the Element have about 1,000 milligrams or close to it of sodium per serving. So it should taste salty. It shouldn't taste super sweet, right? And like Gatorade and those things, like
No, no.
it doesn't do anything. But if you take those higher dosed electrolytes and you feel better,
Mhm.
that's your answer, right?
Right.
Like and especially when you're working out and you're working up a sweat, like you are going to be sweating out sodium and magnesium and potassium, and
Mhm.
so the electrolytes can be super helpful. I just had one of my clients messaged me today, and she's had like a crazy month and she's been traveling and for work and fun and her kids finishing school and all that stuff. And she just had her body composition test done, and she's still decreasing fat and increasing muscle. And she's like, and I just feel so much better. And she said, I really think the electrolytes, adding that in,
Great.
made a big difference. So we have to kind of be curious and just like try something, see how it feels. If we don't feel anything and there's no reason to take it, like don't do
Right.
it. But
Right.
I think part of it is just being curious and making these little adjustments and then checking in with ourselves and asking, do I really feel better because of that? And if the answer is yes, then do more of it, right?
Yeah.
And if not, then we need to keep looking for other answers.
No, I think this is good. So, in kind of summing things up, I want everybody to think about something fun. What are you doing fun in your life, right? Because a lot of times we're not doing fun things. And, thinking about some of the foods that she's mentioned today that are good for our hormonal health, right? Thinking about areas of stress that you can reduce. And then to be curious, like that's a great tip too. Be curious, so like try things, give things time to work. Like it's not a magic 30 seconds in the microwave and you're done. Like commit to the process. So, we've have some of our clients who've been in VIP for years. Some of you are brand new. You're just finishing up your 6-week round. And this is not, your body's not a microwave. And so it takes time for your body to balance things out, and you just don't give up, but be curious and seek the information. And the Faster Way is a great foundation to build upon. So I feel like I should call you Dr. Jennifer.
Oh,
Where,
you can just call me
uh,
Jennifer.
where can people find you on Instagram? Do you have a website? Like, do you have those blogs listed? Tell us where we can find you to follow along.
Yeah, so I have my website is drjenniferhaesslernd.com.
Okay,
And
and
then my Instagram is Jennifer A. Haessler, because Jennifer Haessler was already taken.
that's strange. So if you could also just message me that, like when we get off on Instagram, and
Sure.
just include that in the recording to send out. But thank you so much. This has been really great, and I love it how conversational it's been. And We appreciate everybody joining us. Jennifer, do you have anything left to say uh, as we head on out here? People are
Oh
saying thank
gosh, I feel
you.
like I should have some big pearl of wisdom, but I think, you know, just trust your intuition. If you feel something's off, like keep looking for answers. And the other thing is like, don't, you know, even though our life definitely changes as we, you know, mature, I still believe like it can just keep getting better and better. So like keep looking for new things to challenge yourself with. We can keep getting stronger, right? It would be pretty darn boring if we were just like going to get to here and then it was all tied up with a pretty bow and we just sat there, right? I love the idea that we can keep working to become stronger, better, healthier versions of ourselves forever
Yeah.
until our time comes, right? But hopefully that's far. Yeah.
Amen. Well, thank you so much. It has been such a joy to speak with you. I'll tell you what, y'all, I'm gonna try and have fun. You know what I do when I want to have fun? I tap dance. I tap danced my whole life growing up since the time I was 5. And one of the things that, as osteoarthritis was giving me a little bit of a pain as I went through menopause, I thought I would still want to be able to tap dance. I love, like, I don't perform or I'm not in recitals anymore, but just the joy I have, like, I have several pairs and they just sit around and sometimes I just put them on and tap and it makes me so happy, right? So there's something fun that we all can do, and don't miss out on that component. I just love that. Thank you for bringing that up today. I think that's the thing. Like, I've got tears in my eyes to think about people don't have fun anymore. And it can be such a simple thing as doing the things that bring us joy. So thank you for reminding us of that.
Well, you're so fun. Anybody who needs somebody to make them laugh, like go check out, I'm sure you look at Renee's Instagram account. You'll see her dancing on there. I love it.
Well, thank you again. And everybody, thank you so much for joining. For those who are joining us recording, thank you so much. Please follow Jennifer. And Jennifer, just send me your website, just Instagram it to you, and then I'm going to put it in the recording and mail it out to everybody. All
Okay,
right.
perfect. All right,
Thank
thanks
you so much.
everybody.
Bye-bye, everybody. Bye-bye.